Thanks very much for the opportunity to input today. We're delighted. We've been involved with Belfast Healthy Cities on their health literacy work now for a while. I feel like a bit of a fraud standing up here because it's actually my colleague Mary O'Hagan who's our representative on the health literacy group, and she works in the Building Community Pharmacy Partnership programme, so she should really be here doing this today and not me. But just a little bit about us then. We are a network organisation. We work across Northern Ireland and we have about 1,800 members at the minute. Our work focuses and has focused for the last 21 years on ending health inequalities through community development. We want to create a fairer and more equal society because health inequalities are unfair and they're avoidable. And we all know that the poorer you are, the worse your health will be. So that's something that we want to try to get the root causes of that really understood properly and appropriate action taken across the social determinants. So our work tends to focus on 3 key areas. A big part of what we do is connecting people, connecting individuals within communities, and then connecting communities with each other, and then connecting those communities into the policy and decision making world. We do that through enhancing their knowledge and their skills development. But a really important part of our work is the policy and the influencing work we do. So the examples that we're able to generate, the work that we do in-house, the great communities that we work with, the impact that we're able to demonstrate on their behalf, that's the way in which we can help communities to find their voice and use that expertise and skill that they have in order to influence change for the better. About 14 years ago, CDHN was approached by the Department of Health. They had an idea for developing partnerships between local communities and pharmacies. At that stage, I suppose, Ruth Sutherland was the director of CDHN, and she could see, along with Norman Morrow, who was the chief pharmaceutical officer, and Vanessa Chambers, who was a pharmacist at the time, they could see that there was a real role for pharmacy within local community as a hub for public health that wasn't really being exploited. So they came up with the idea of doing a pilot programme that would see the investment in the development of partnerships. Fast forward 14 years and this is our model of delivery. It's a really simple concept, but it gives powerful results, and it has partnership right at the core of it. That partnership is between pharmacies, not just the pharmacist, but also other staff that work within the pharmacy and the local community. And a big part of what has to happen within these partnerships is good quality signposting. So the local community and the pharmacy staff, including the pharmacist, really need to know their community well and know what else is out there, because no one person or organisation can support everyone in all of their needs, particularly when we're talking about the most vulnerable in society. So signposting has to be a crucial part of it. Our investment that we make helps remove barriers to people participating, and it facilitates the development and the growth of the partnership. There's flexibility in content of how partnerships can develop and the sorts of things that they want to address, but there's no real flexibility in your adherence to the principles, and these are the principles. So partnership working, locally defined needs that focuses on disadvantage, the social model of health, and the community development approach. So we're not flexible on those components, but how you do it, where you do it, when you do it, and who you do it with is entirely up to you. There's probably, between 550, 600 pharmacies across Northern Ireland, and at this stage we've probably worked with about 3/4 of them, which is really good for us. We support around 70 partnerships every year, some of whom we've worked with for a long time, some of the partnerships we've worked with for 10 years, but without fail we get new partnerships emerging every single year. Our investment is small, but the yield is great. We invest either £2,000 or £10,000. £2,000 is where you've got a great idea but you've never worked with a pharmacist before, or vice versa, and you just really want to explore the relationship. And £10,000 is where you maybe have more of an established relationship and you want to do something that's a bit more developed. We never set out to have health literacy as a core part of this work. It kind of emerged as something that was sort of intuitive. It's something that just, when we became involved with Belfast Healthy Cities and heard the terminology of health literacy, immediately the lights went on and we said, right, yes, these aren't words that we've used to describe our work, but it absolutely fits, and that will be the same for practically everybody in this room. Health literacy isn't a new way of working for us. The language is new, and what I like about it, which is maybe the cynic in me, is that it does open the ears of people who may not necessarily listen to the type of work that you do otherwise. So, that's good. We also recognised a long time ago, like many of you, that the conditions that you live in have a massive impact on your health. We know that. But unless those conditions are really fully understood and taken into account and taken action on, health information can only ever have a minimal effect or impact. We see this in particular when you look sort of in current times at the overemphasis on lifestyle, behaviour change and individual responsibility. This is a complex health system that we're dealing with. It's difficult to navigate for the most intelligent and literate and confident people, even more so for those that are living quite chaotic lives and are feeling quite vulnerable. Add into the mix a set of policymakers and politicians that don't really understand social determinants particularly well all of the time, or the concept of taking action across social determinants doesn't really look good for the most vulnerable in our society when you take all that into account. So we're really excited at this piece of work and being involved in it. It's an important component of our work and will continue to be, because that first line there I took from an Institute of Health Equity report on health literacy. Health literacy is the bridge between people and health settings. So it's really important concept for us. And it does give an opportunity from our perspective to really work on the issues of circumstance, lack of control and power, and the impact that has on your ability to hear information, take it on board, analyse it, act on it, make a change, sustain that change. Unless you understand the conditions that somebody in the context that somebody's operating and living in, it's going to be very difficult for you to come up with a strategy that's really effective for them. I like this diagram. I think it represents our work really well in relation to pharmacy, and again it's from the Institute of Health Equity report. And I think that because we see health literacy in its absolute broadest sense, we wanted to use BCPP as a way to illustrate that, because our work and the way in which we work in partnership with pharmacies and local communities, it kind of fits within all of these different strands. So it's not just about the impact or difference made to individuals, although that's important. It is also about changing the system. So in our case, it's as much about how we can change the way in which community pharmacy think and operate and see the opportunity to develop relationships with people that are coming into their shop all the time, as it is about making behaviour change or lifestyle changes for those people that are coming in to use the pharmacy as a service. And it also demonstrates how community and pharmacy together can take collective action against some of those broader determinants. So health literacy of professionals is of paramount importance to us. Not just how do we improve the health literacy of communities, where we think we can do that, and there's lots of really good examples of how that can happen. It's how we improve the health literacy of professionals as well. So why pharmacy? Well, when you look at the range of people that, hopefully you can read that okay, the range of people that pharmacists deal with, on average 750 older people, people recently discharged from hospital, 600 carers, 500 under 5s, 50 people with diabetes, and so on. So they're going to deal with huge volumes of people with a massive range of conditions, some complex, some simple. 123,000 people, both healthy and ill, visit pharmacies across Northern Ireland every single day. And over 83% use the same pharmacy routinely. That's key. When you talk about developing meaningful relationships with people, if you've got that sort of loyalty base already going, that makes you an absolute prime place to begin to develop those sort of outreach and good relationships. So it is a really good community resource and asset. it's sustainable and it's accessible. And like I say, we've got like nearly 600 pharmacies across Northern Ireland. It's a really interesting place, pharmacy, when you think about the range of information that they hold, because they will know in an area there's a lot of, you know, new mummies that are on antidepressants, or there's a lot of families with children under 5 that have asthma and are on inhalers, or there's a lot of over 50s that are on medication for their cholesterol, and so on and so forth. They'll also know if there are a lot of people coming in just for a chat because they're lonely. What they don't have is a good route to share that information. So they have that information, they might often not get the chance to analyse it, and if they do analyse it, they probably won't have many avenues to share it. So that's the kind of basis on which we encourage them to develop partnerships with local communities, because that's a brilliant avenue to begin sharing that information. And it's a really good basis on which to start planning to take action in local communities. And here's another reason why improved health literacy is really important within pharmacy. Brenda, you mentioned the medicines optimisation work that you were involved in, that we were involved in as well. So at any one time within the population, 70% of people are taking prescribed or over-the-counter medicines to treat or prevent ill health. But an average of £18 million are wasted annually in Northern Ireland because people don't take the medication properly, or there's, as they like to call it, non-compliance issues and so on. It's a huge amount of money. 1 in 15 hospital admissions are medication related, 2/3 of these are preventable. So this is a really good reason why health literacy is key, because we need to understand why this is happening. Now, what was interesting whenever we did the medicines optimisation work was that when we asked for a kind of an unpicking of the statistics, we weren't really able to get to the root of where exactly this non-compliance was happening. So we didn't get a sense of whether it happens equally across the population, because we know that your education isn't necessarily a predictor of your level of health literacy. You can have highly intelligent and literate people whose level of health literacy is quite low, but it doesn't take a rocket scientist to work out that if you haven't had access to good quality education and your literacy is low, your health literacy is probably going to be quite low. But we weren't able to get a sense of that when we were trying to do this work on medicines optimisation. So we didn't have the demographic, and we were trying to come up with a pathway for people without knowing who was going to be most affected. Now, the pathway for somebody that's quite affluent, well educated, well supported is going to be very different to the pathway for a homeless drug addict. So knowing context and conditions is key. And here's a diagram that I think explains that really well, especially for health professionals. This is a diagram from a journal article that Margaret Whitehead co-authored really recently, and it's around the whole issue of power and control and its impact on your kind of destiny. But if you look at that third column, I'm not sure how to make the wee oh, what have I just done? Okay. I'm not sure how to, there we go. Okay, so if we look at this column here, right? These are the responses that health professionals are probably most likely to encounter from someone who's got a low social position, so somebody coming from a socially deprived area. So it'll be the person coming from the deprived area will feel overloaded, unable to cope, won't have the power to influence critical decisions, have uncertainty about the future, aggressive, maybe overtly aggressive, may have a passive-aggressive response, and may have lots of stress-induced disturbances, it's called here. Okay, as a health professional, you're going to see that. You're either going to see anger, hostility, people very, very cross with you, or you're going to see the person that'll say, yeah, I'll do that, and then they walk out and you know that they've no intention of doing it. Okay, that will leave you very, very frustrated. Of course it will. Especially if you have no idea the conditions that that person's coming from that has caused that response in the first place. Now, I also thought this was really interesting, this one here, that when you take all of this into account, the other things that it will lead to is a real probable decrease in the likely success of any behaviour change interventions that you try to put in place. So it's not to say that those things aren't important, But this is why health literacy is really crucial for all. It's not just the extent to which people hear the message, take it on, make the change. It's that you understand when you're given the message, the context and the conditions that the person is in that's hearing the message, and the likelihood of them hearing the message that you want them to hear. So for us, that is the bottom line with health literacy. That is why it's so crucially important. So I wanted to show you a quick video clip that I think demonstrates this, or I hope it does anyway. Firstly, of the type of partnerships that we invest in. That's a particularly difficult one in that the group involved were street drinkers, but would also be fairly typical of the sort of partnerships that we invest in. Street drinkers, homeless, drug addicts, very vulnerable, leading chaotic lives. And when you think about the sort of health messages that we're encouraged to give to people around smoking, physical activity and eating 5 fruit and veg a day, those don't really seem as relevant when you overlay it with the context of that particular group. What's also interesting and a wee bit funny about that one is what Patricia didn't say, the pharmacist, is that she used to spend all of her time chasing that group out of her pharmacy before she got involved. And the first day that she arrived for the programme, they were all sitting there, and she said, talk about feeling like the tables had been turned. She arrived with her PowerPoint presentation and she had her information that she was going to share. She closed the laptop, she put it to one side, and she genuinely spent her time getting to know them, so that by the end of the programme, it was probably about a year long, she was going swimming with them. And when they came into the Boots pharmacy, which was in a shopping centre, on a wet day, she would get the girls to take them in and make them a cup of tea so that they wouldn't be cold. That's health literacy. To me, that's health literacy. So just a really good example of how developing that partnership where there's real respect for the expertise from the pharmacy, from the supporting community organisation, and from the people themselves and what it can yield. We have a really good data set with this programme. We've been gathering data on this consistently now for about 6 years. And we gather loads of information, so we can give you all of the input information, like how many sessions and how many people and how many one-to-ones and how much signposting and all the different topics. If you're interested in that sort of information as well as the outcome information, you can download this impact card from our website and have a look at it. I don't have one for everyone in the audience, unfortunately, and it does need to be updated, which is a task that we're going to do quite urgently. We also think that because the data set is so huge, there's a lot of information that's untapped in it. And because we haven't really been looking at this with a health literacy lens yet, we think that with a little bit of mining, we probably could find some information that might be really helpful for your baseline. And so that's something, again, that we want to look at. But we're really keen that we could show the change was happening in the local communities, and this is what we measure against these 3 outcomes. And we see marked improvements in all of those areas. Just a couple that I want to point out in particular that I think are relevant to health literacy. Confidence in going to the pharmacist for advice increases from 61% to 83%. So year on year we do baseline measurements with every single project and with every core group within every project. So if we've 70 partnerships, some projects have 1 core group, some have 3. So it's quite a wide span of people. So their confidence is increasing quite a bit. Understanding of how to improve their own health increases from 60% to 81%. And people that are actually making changes to their lives, some of that is health behaviour related, increases from 47% to 70%. And that's a consistent trend that we would see year on year. The other thing that's interesting is that 97% of pharmacists agree that they've learned new ways of engaging within their local community. So there's something about this way of working that seems to work, and it's a consistent change. I just wanted to share with you some of now we could have picked hundreds and hundreds of responses and just wee kind of pieces of wee snippets of information that people give us, and these are really, really simple ones, but any of them could have ended up very differently with a lot more pressure on pharmacy or on GP or on emergency departments. Somebody was suffering from depression, but by being involved in the project, their mental health improved. We measure improvements in psychological well-being using the General Health Questionnaire 12. So that's another one of those statistics that we see. We see psychological well-being improve for some dramatically throughout the course of the programmes. But their mental health improved. They've gone to the GP to work towards cutting down on their use of medication. An older lady, this is funny because you always get these types of queries, but they're really important. She queried taking Lemsip and paracetamol together, and the pharmacist was able to clarify that there's paracetamol in both and that she probably shouldn't do that. That might seem like a really kind of flippant example, but it's not, because had she done that over a period of time, could have had some quite dramatic health consequences for her. And then another pregnant lady was concerned about gestational diabetes, advised to see her GP, her blood pressure was very high and her baby was born 12 hours later. So there's some quite dramatic examples like that as well. I love these ones though, because for me this is really heartening, and this is the sort of culture change that we want to see within primary healthcare, not just pharmacy but right across any community-based primary healthcare. And that, for me, this is health literacy in action. So these are comments that the pharmacists have made. Spending time with local women and developing relationships allows me to understand the stumbling blocks that can impede people from making changes to their lifestyle. Now that might seem like a very simple thing to say, like why on earth would they not understand that? That is not how our pharmacists are educated in their third level, when they're completing their third level qualifications. That's not a huge part of their training at all. They are trained in understanding conditions and complications and dispensing medication, not building relationships in order to understand context and conditions. This one is brilliant. Supporting a mother to help her young child manage their asthma. So they've gone through all the inhaler techniques, things they were meant to do, things weren't improving. Through chatting, we discovered she was living in a damp house. Light bulb went on. This pharmacist actually got in touch with the GP. They wrote letters of support to the housing executive, and they were able to put enough pressure on the housing executive to get this family rehomed. So she got another house and the asthma has improved. Health literacy in action. Just to finish then, future plans. We want to do a lot more of this work, so we've decided to kind of test it out a little bit. Anne and I got chatting about what sort of work we could do. And we've got a number of projects we've invested in East Belfast, and we had been toying with the idea of trying to develop some sort of informal network for those pharmacies in East Belfast, so we were contacting EBCDA about that. Then we chatted to Belfast Healthy Cities about maybe using health literacy as a bit of a hook to get pharmacies involved, and the Public Health Agency also wanted to kind of get a network like that to pilot their Take 5 materials, maybe in a slightly different way. So it's like all the planets aligned and all the bits seem to be, the strands all seem to fit well. So that's our next kind of piece of work, is to do some work with between 6 and 10 pharmacies within East Belfast. And our steering group for building community pharmacy have committed a small amount of money, but still some money to facilitate that happening. So we'll be recording it, and we'll obviously be looking very closely to see what the results of it are. If there's lots of information about BCPP on our website, and like I say, and those video links are on it, and if you want to download the impact card, please do. Our membership is free, so if you're not a member, you should be, because it doesn't cost you anything other than the time it takes to fill out the membership form. And then that means that you're connected into us, and you'll be informed of all the things that we're doing. So thank you for your time.